as you're talking, I'm thinking there's so much time spent on communicating stories,
Mm-hmm.
but I would imagine there is an art and a science to listening to stories. Is that what you mean about
Yes.
witnessing stories?
Yes. So a class that I teach right now in the communication department is called Health Narratives. And much of that class is discovering ways that we can become better listeners to people in our lives who have healthcare needs. So this might be people with chronic illness, this might be people with acute illness, but how as their family member, how as a potential care provider for them, how can we be better listeners? So when someone is telling us about chronic pain, how can we make sure that even though it might be day after day after day that your loved one talks about their pain, tells you how much they're in pain, how can we be better listeners to that and not do maybe the natural reaction of, okay, I know that you're not feeling well, but let's move on from that. How do we really sit and listen to the people in our lives that have healthcare needs? So yeah, that class focuses not just on the narrator of pain and illness, but also how we can be better audience members and listeners to our people.